Rhazes didn't simply study medicine. He reinvented it. Educated in Baghdad, one of the most advanced cities in the world at the time, Rhazes absorbed the knowledge of Hippocrates and Galen. But he didn't stop there. He questioned their theories, challenged their assumptions, and, with an inquisitive mind, expanded on their work. His studies were not confined to dusty books. He combined them with real-world observations, treating patients, and making groundbreaking discoveries about the human body. His early experiments in alchemy, what we now call chemistry, laid the foundation for his later work in medicine. He believed that through careful observation, reason, and experience, one could uncover the mysteries of health and disease. His belief in empiricism would become a hallmark of his medical philosophy. Rhazes wasn't just a groundbreaking physician. He was also a visionary in public health. As the head of the prestigious hospital in Baghdad, he developed innovative methods to improve hygiene and prevent the spread of a disease. He insisted on cleanliness, ventilation, and the importance of a healthy environment for recovery. Ideas that were centuries ahead of their time. By separating patients based on their illness, Rhazes created the prototype for what would become the modern hospital ward system, ensuring that diseases didn't spread within medical facilities. Perhaps Rhazes' most enduring contribution to the world was his Kitab al-Hawi, or the Comprehensive Book of Medicine. This monumental work was no ordinary text. It was the culmination of centuries of medical knowledge, combined with Rhazes' own extensive research and clinical observations. The Hawi was a vast encyclopedia of medicine, bringing together knowledge from across the ancient world and adding Rhazes' groundbreaking insights. It covered everything from anatomy, surgery, and pharmacology to the diagnosis and treatment of specific diseases. But unlike earlier works, Rhazes didn't merely summarize ancient theories. He improved upon them. He was critical of any method that didn't work and wasn't afraid to offer alternative treatments based on his own experience with patients. Though Rhazes is best known for his medical contributions, his intellectual range extended into philosophy and metaphysics. He was a prolific philosopher who engaged with questions of existence, ethics, and the nature of the soul. His works, such as the philosophical approach and the spiritual medicine, tackled the most profound questions of his time. Rhazes was unafraid to challenge both religious and philosophical authorities. He believed in rationalism and critical thinking, even when it meant confronting the religious dogmas of his era. His approach to the mind and soul influenced later thinkers, both in the Islamic world and Europe. One of Rhazes' most remarkable achievements was his pioneering work on the diagnosis of diseases, particularly his distinction between smallpox and measles, two diseases often confused in ancient times. In his famous treatise on smallpox and measles, Rhazes was the first to accurately describe their symptoms and differentiate between the two. This was a revolutionary breakthrough. By differentiating these diseases, Rhazes improved the accuracy of diagnosis and treatment, saving countless lives. His clinical observations laid the groundwork for modern virology and epidemiology, long before these fields even had names. Rhazes was ahead of his time in understanding the connection between mental and physical health. In his treatise Spiritual Medicine, he argued that mental health was as important as physical health, and that diseases of the mind should be treated with the same seriousness as those of the body. He emphasized empathy and understanding, encouraging physicians to consider both the emotional and physiological states of their patients. Rhazes' approach to mental health laid the groundwork for modern psychiatric practices. He was one of the first to argue that the mind could affect the body, and that treating mental illness required both compassion and scientific knowledge. Rhazes also made groundbreaking contributions to the field of optics, the science of light and vision. He studied the anatomy of the eye in detail and experimented with different lenses to improve sight. His research on optics influenced both medical and scientific communities in the Islamic world and beyond. His work on the anatomy of the eye and vision set the foundation for future innovations in ophthalmology and optical science, linking the physical mechanics of sight with the philosophical understanding of perception. Rhazes wasn't just a physician. He was also a pioneering pharmacist and chemist. His Book of Secrets, or Kitab al-Asrar, explored the practical applications of chemistry in medicine. He studied various substances, distillation techniques, and created compounds that were used to treat ailments. Rhazes' work in chemistry influenced both Islamic and European alchemists. His methods for producing medicines from natural materials formed the foundation for the pharmaceutical sciences we know today. Rhazes was not only a physician of great skill, but also of great compassion. He believed that the role of the doctor was to serve humanity, regardless of wealth or social status. He often treated the poor without charging them, and he wrote extensively about the ethics of medicine, urging doctors to put the well-being of their patients above all else. Rhazes' contributions to medicine, chemistry, philosophy, and public health reverberate through history. His works were translated into Latin and studied by scholars in medieval Europe, shaping the course of Western medicine. His name may not be as well known as some, but his impact on the world is undeniable. More than a millennium after his death, the spirit of Rhazes lives on in every doctor, every scientist, and every philosopher who strives to push the boundaries of knowledge for the betterment of humanity. And that's the end of the story of Rhazes, the physician, philosopher, and humanitarian whose genius changed the course of history.